Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. We'll be speaking with Rae Jimenez in this segment, Chief Product Officer at AAPC. She's joining us to discuss the medical coding and why medical coding is important for patients to know what's the code before getting a surgery or procedure, and how nurses and doctors can better advise their patients. Medical coding has become a great career for a lot of people, allowing them to work from home. Welcome to Health Professional Radio, Rae Jimenez. Thank you for joining us.
Thanks for having me.
Chief Product Officer at AAPC. Give us a little insight into your professional background briefly, and then explain to us what medical coding actually is.
Okay, so I've been with AAPC for 16 years now, in the healthcare industry for over 30. I was involved with AAPC, which is a professional association that got our start into medical coding, but has branched out and to cover the entire revenue cycle. So everything from the claims processing standpoint to payment. I was a local chapter officer and member of AAPC before joining as an employee here at AAPC. And in my role, I oversee all of our product lines so that we have a cohesive offering for all of the professionals. What motivates people to be part of a professional association is support, networking, access to tools, resources.
Pay health practitioners for whatever service they are providing, right?
That is correct.
If that's the case, why is coding so important to health practitioners when that aspect of it seems to be taken care of by the insurance companies? Why is it important to practitioners?
Well, for practitioners, it's important because it's a way for them to describe what they've done so that the payer can pay them appropriately. So they're identifying their services through these codes. Payment is one aspect of medical coding. The other aspect is all the data that we capture from it. All of the tracking and trending of patient outcomes, instances of disease, why is one population having a higher instance of a certain disease or complication versus another? What might be going on in that area that patients are benefiting from that we could look at to say, what other programs could we implement to be proactive for certain disease occurrences? We saw all of the tracking and trending live when it came to COVID and all of the monitoring of COVID cases and hospitalizations. Without having codes to be very specific about that disease, we wouldn't have known the instances and had all that data to work from.
You've explained why coding is important for health practitioners. Now, explain why it's important for me as a patient to understand what the code is. Since, I trust my doctor, I have trust in my insurance. So why can't I just sit back and let nature take its course?
Well, with insurance, there's a lot of complexities of certain services that are covered versus not covered. There are certain interventions that a provider might try. For example, if a patient's having chronic pain, they might have a patient go through segments of physical therapy prior to other more intensive interventions. This is all communicated through the codes that we're submitting in payment policy. So as a patient, it can be very confusing. And let's face it, as a patient, when we're experiencing healthcare, it's not always under the best of circumstances. So getting the billing right is just one less headache they have to deal with after the encounter has occurred.